At SyncSim, we've created a world for our students. A world that, very much like the real world, has individuals that seek medical care. We have over 90 patients and 36 different opportunities for students to engage with these patients in a variety of settings, not just a hospital. We have outpatient clinics, residential centers, public health department, a free clinic, urgent care center, and many others. Let's take a moment and get a glimpse of the sights and sounds of SyncVille. As a student starts their day after they have a pre-conference and a pre-brief with their instructor, the first thing they're going to do is get a report. So let's listen in.
Rodney Malco is here. He's admitted for atrial fib. He presented through the ER with a rapid rate. He feels weak. He gets short of breath with exertion.
This was an example of a typical change of shift report. We want to teach our students about the formal SBAR process, and this gives us a chance to work with the students and have them critique those reports and tell us what they would have done differently. Let's pop back in and see what students are doing now. It sounds like someone at the nurses' station is asking for the students' help.
Hey everyone, Mr. Malco's call light's going off. Is anyone able to go answer it and see if he needs anything?
A great clinical experience requires a lot of things, but probably one of the most important is going to be the clinical instructor. We're very excited about the faculty that have come to work with us. Let's listen in to Dr. Fabry as she greets her students and gets them prepared to see the patient.
Well, knowing Mr. Malco's cardiac history and the fact he's here for the fluttering in his chest and his heart palpitations, my goal for the students today is that they perform a focused cardiac assessment and pain assessment. We make sure he fully understands his plan of care, including the tests he's going through tomorrow, as he's scheduled for a TEE and cardioversion. So there's a lot of patient education opportunities. We also want to make sure his pain is under control, his tachycardia is being well managed, and that we update the provider based on any abnormal findings so we can deliver Mr. Malco great care today.
The faculty and the students will go in and they'll see the patients after doing their morning assessments and giving their morning medications. Let's see how the students do when they go in and interact with Mr. Malco.
Good morning, Mr. Malco. My name is Hannah, and with me are my fellow nursing students. We will be your nurses today. I see you had your call light on. Is there anything we can do for you?
Yeah, good morning. Thank you for coming to my call light. I'm not feeling really good.
I'm so sorry to hear that, Mr. Malco. What seems to be wrong?
Can I get something for my nerves? My heart feels like it's going to beat out of my chest. This cardio thing you plan to do. I've seen this stuff on TV and it scares the crap out of me. I don't want to die.
The students will continue to interact with and assess Mr. Malco. They take vital signs and ask important questions. And the faculty member is present the entire time. Let's head back into Mr. Malco's room as they finish off their assessment and their instructor regroups them to get a sense of what the plan of care should be.
All right, guys. So we have our patient here who is admitted with AFib for observation. He now just told you he has a racing heart and it's fluttering in his chest. What do you think our next steps should be?
This is always where it gets to be fun. As the students start to think for themselves, begin to work together, and come up with solutions. Let's see what they have to say.
Ooh, I think we should perform a focused cardiac and pain assessment and gather more information.
I think that is a great idea, Celia. How about you get us started? Where would you like to start?
Well, Rodney, we need to get a new set of vital signs on you. This will tell us how fast your heart is beating and how well you're perfusing. I'm going to put this blood pressure cup around your arm. It's not going to hurt, but it may have a little tight squeeze to it.
We've gathered our assessment findings. What do you guys think should be our next step?
I think since this is a new onset of discomfort, we should notify the provider. He's scheduled for a cardioversion in the morning. Maybe the doctor will want to do it sooner?
I agree that we should call the doctor, since his discomfort isn't being controlled adequately with the cardizem drip. The patient may need something more for pain like morphine.
Calling a provider can be a really scary thing, especially for a nursing student who doesn't get the opportunity to do that when they're in a clinical environment. At SyncSim, we believe this practice with repetition is critical. We provide an opportunity at every event for students to call a provider and practice that SBAR communication. So let's listen in.
Good morning, Dr. Murphy. My name is Taylor, and I am the nurse taking care of Rodney Malco today at the SyncVille Medical Center in room 3. Rodney is an 82-year-old male who was admitted this morning for observation due to complaints of heart fluttering in his chest. Mr. Malco has a past medical history significant for hypertension, hypercholesteremia, and he had a myocardial infarction 2 years ago with a stent placement. Today, he's complaining of heart fluttering, and he says that his heart is, quote, beating out of his chest. He feels weak, he gets short of breath with exertion, and to make matters worse, he's really nervous about his TEE cardioversion that's going on tomorrow. So we just got his vitals. His blood pressure is 126/74. His pulse is a little tacky at 118. His O2 is at 97% on room air. Respiration's at 18, and he has a temp of 98.1 degrees Fahrenheit. His tele is showing tachycardia and AFib, but he doesn't have any other symptoms. He is allergic to morphine and eggs, although eggs is not in his chart yet, which we will update. He's scheduled for a cardioversion, like I said, tomorrow. With his ongoing chest discomfort, I was wondering if you would like to, number one, move up his cardioversion, possibly to today. And also, I was wondering if you would maybe want to order like a sedative or any additional pain meds.
Hi, Taylor. Thanks for calling. Let's see. I don't think right now I'm going to move the cardioversion up. He sounds fairly stable, but may just need something for anxiety. So I think we're going to try some Ativan and see if that provides any relief for him.
Okay. So you said we're not going to move it up? Correct. Okay. So you would like me to administer Ativan for his anxiety. How do you want the Ativan given?
Let's go ahead and try Ativan 2 milligrams Avi Push, and I'll enter the order into the chart for you just this one time.
Oh, perfect. Thank you. And is just one-time order, or do you want it PRN?
Let's just do one time right now, and if he continues to have complaints after about 30 minutes to an hour, I want you to do another set of vital signs. Let's go ahead and do another 12-lead EKG, and then I want you to call me back.
Okay, so just to confirm, we're going to be doing the TE cardioversion in the morning, but you are going to enter in a one-time dose of Ativan 2 milligrams IV push. Then after we give that, if he's not feeling better in 30 minutes to an hour, we'll do an updated assessment with vitals, get a 12-lead EKG, and then call you back. Am I correct?
That is correct. Thank you.
It's not easy to demonstrate how all of this works, and it can probably seem odd for someone that hasn't experienced it yet. But to our students, this modality of simulation is powerful. The ability to have authentic conversations, work together, make decisions, and have the ongoing support of a faculty member in real time with real people is truly unique. Hopefully we've satisfied some of your curiosity. You're always welcome to bring your students to an event with us and see for yourself how educational, effective, and fun SyncSim and SyncVille can be. Thank you for joining.